The Octa Research Group reports that COVID-19 cases in Cebu have started to go down. To confirm this, DOH Region 7 Spokesperson Dr. Jean Loreche joins us live right now. Good afternoon, Dr. Loreche. What does your latest data suggest about the COVID-19 trend in Cebu? Is it really going down?
Hi, good afternoon, Sean. Thank you for inviting me. Yes, we can see already that although we are still in the triple digits, but then this is already in the lines of 100s. Unlike where before, 2 weeks ago, we were seeing around 200, 300 for, 300 cases. But this time, our cases maintain at 150, 160 daily. So we also see that for the average 1 week, we have already 1,240. That's for 7 days. That is really low when you compare that to the previous weeks. And of this, we find that the index cases for Cebu City of this 1,240, 558 only, meaning to say these are the new cases that we get to see. The rest are actually close contacts, 528 more or less. That means we are doing contact tracing aggressively and testing all these contacts.
All right, that's very good to hear. Now, even better news is that Octa says that Cebu's virus mitigation efforts can actually be used as a model. Now, we know that Cebu has opened up to tourism as well, opening up borders a little bit more as per the order of Governor Garcia. But what exactly did the province do to be able to achieve this?
We have to put things in the right perspective, Sean. Cebu Province and Cebu City are two different, places. So Cebu Province, that is where Governor Gwen Garcia is. That is for the syndromic surveillance, no testing. But then when you come in with a clear medical certificate that you have no symptoms of COVID, and that once you are inside, and should you develop any symptoms, then you get contact traced. You do the isolation and the testing protocols. For Cebu City, that is the one that I reported to you a while ago, which is at the center of it also, and which has the highest number of cases previously and currently also. We still lead the cases here in the Central Visayas. You will find that we do have mitigation factors despite the opening up of the borders. No? So mapapansin din natin na si Cebu City per se has not removed testing for arrivals here. But then we have implemented additional measures. Like for example, although you do not undergo the 10, 14-day quarantine before you are released, when you test positive, we have modified that one. And secondly, we have actually instituted more, we have more contact tracers this time than before because we really want to have aggressive contact tracing. Our isolation facilities, we now have hotels joining us to become isolation facilities to be able to decongest the hospitals. On top of that, we have this, what we call, roving people who are private citizens involved, with our campaign against the COVID, for us to be able to see really and full implementation of the minimum public health standards.
All right, thank you for clarifying, Doc, that it is, the mitigation efforts of Cebu City that can be used as a model. But I want to ask also, which factors can you attribute the recent spike in cases? Have you locked down the actual cause? Is it due to poor protocol compliance? Is it due to the new strains? There's a lot of news going around.
Yeah, so there are several factors that will actually contribute to the rise in cases. And primarily, that would be, people, because of the mobility, people sometimes forget really to be able to adhere to the minimum public health standards. That is number one. Number two, there are more establishments that are open. Sometimes also we find these establishments, they lack that, the willpower to be able to follow through the public health measures that should be installed and instilled in their workplaces. Karamihan ng ating mga kaso ngayon are households and workplaces. So dinadala nila yun sa community natin. That's based on our studies and our data. So yung dalawang yan, dagdagan natin na of course we know also that we have our mutations with potential clinical significance. May nadagdag tayo na 36 sa bagong data ng Philippine Genomic Center, making it 70 already for Central Visayas. But then if you look at it, these are cases na kinuha natin, ang samples nila when they tested positive. They underwent the mandatory 14-day quarantine, exhausting also contact tracing and isolation. So heto naman masasabi natin, these are already contained. So basically, I don't really, in our data, the mutations with potential clinical significance isn't really the main driver for the increase in cases.
Also very good news, Doctor. Now, what is the latest, since you already started tackling this on Cebu's tracing of patients that are probably or possibly infected by the new variants?
Heto naman kasi when the results come out, coming from the Philippine Genomic Center, relayed to us by the Epidemiologic Bureau of DOH Central Office, tapos na po yung ating mandatory 14-day quarantine. And most of these are asymptomatic individuals. And so even if they were symptomatic, they undergo the mandatory 14-day quarantine, we do the aggressive contact tracing. So wala talagang nabago. Whether it's an MPCS or whether they are the regular, usual COVID cases na meron tayo, the active contact tracing is still there. Now, the beautiful thing is, which I have always been saying this, that we had a problem with our Emergency Operations Center sometime in the early part of January to mid-January. Nagbawas kasi tayo ng mga tao dahil for a long time, ilang buwan tayo na napakababa ng ating mga kaso. So, biglang napilayan yung Emergency Operations Center natin, tapos binalik na naman natin ito ngayon. So, they are back on their feet, and I believe that accounts for why our numbers are decreasing kasi nga napaka-aktibo ng ating Emergency Operations Center to address all these issues.